one of my patients passed away this week. I keep worrying that there may have been something else I could have done for him.
I've had to break the news to several families that their loved ones didn't make it. It breaks my heart every time.
It's getting to the point where we have started to make decisions about which of our patients gets put on a ventilator since we have so few. I never thought I'd had to be the one making these decisions. I became a doctor to help everyone. I'm not sure how I'm supposed to cope with this.
My mentor just passed away from COVID-19. She seems so healthy. I can't believe she's gone.
These are moments of profound grief and loss. They're powerful, personal experiences, and are often felt immediately and sometimes even long after a tragic event. These losses of grief and emptiness can leave intense effects on people's thoughts, feelings, behaviors, and relationships. During times like this, expressions of strong emotion are common and expected. Some people may cry or seem really angry, while others seem numb or may even respond in ways that are hard to understand. Grief is sometimes experienced over time. People can feel depressed or lose pleasure in daily activities following a particularly tragic experience. In the cases where doctors must make difficult life and death decisions, such as in the case where there aren't enough medical supplies for all their patients, some providers report feeling similar reactions to those of combat veterans. People experience grief in different ways and for different lengths of time. Some people feel deep sadness throughout the day, and other people might fall into a relatively constant state of sadness. Some immediate reactions of grief may only last a few days, while others may last for years. There isn't a right or wrong way to grieve or to cope. Some have used the phrase moral injury to describe the phenomenon. Moral injury is a term used to explain the trauma of violating your own conscience. Most healthcare workers choose their profession so they can help everyone they encounter. But in times like this, that isn't always possible due to factors that are out of their control. It is normal for people to wrestle with the decisions they made, even though they were doing everything in their power to help others to the best of their ability in that moment. During this time, you're likely to encounter others who are experiencing grief and the distress it causes. When someone experiences grief following a loss, there are some simple things to keep in mind that might be helpful. Be there. Often the best thing to do is offer a steady presence. Be accepting. It is not helpful to try to change people's reactions. Instead, try to share those moments exactly as they are. Let it be. You don't need to try to fix anything, and there likely aren't any quick or easy solutions. A grieving person might feel hurt, invalidated, misunderstood, or even guilt if they think that their emotions are wrong. Keep it simple. Listening and just checking in with a person can be great comfort. Grief can last. Sometimes people feel supported immediately following a loss, but report that the support decreases as time goes on. Checking back in weeks or months after a loss can be very meaningful. Self-care is especially important during times when you are giving so much of yourself to help others. Here are some things you can do to help yourself through difficult times. Connect with peers who can help to normalize and validate your experiences and communicate your thoughts, feelings, and concerns. Stay in touch with your family and friends. They can help ground and support you and be a place where you can recharge. Take care of yourself. Take breaks. Don't skip meals. Take time to rest and to do things you enjoy. Taking good care of yourself is one of the best ways you can ensure you're able to take care of others. Practice self-compassion. Think about how to talk to yourself and how to analyze your actions. Ask yourself if you would talk to a friend in the manner you talk to yourself. And if that answer is no, it's time to pause and shift gears. Focus on what you can control and give yourself credit for how hard you are working. Loss is a part of life for everyone, and due to the nature of their role, healthcare workers are often exposed to more situations of loss than the average person. Some losses and experiences will be impactful enough to cause significant feelings of distress and grief. Experiencing grief is difficult, but you are not alone. These experiences can increase vulnerability to developing a mental health condition. If someone develops symptoms of mental health issues after a loss, especially if they've experienced complicated grief or trauma, there are several effective, evidence-based forms of treatment that are able to help. The first step is to ask for help and accept that getting help through these challenging times is very normal. You are not expected to do it alone. If you're struggling to cope after a difficult event, talk to a trusted professional. From all of us, we thank you for your hard work and dedication to taking care of those most in need during this difficult time.